Assalamu alaikum. I'm Dr. Saad Maroof Saeed from Department of Pathology, and I'll be dealing with the hemodynamic disorders and the associated diseases like shock and the various thromboembolic diseases. This is quite a vast chapter of this hemodynamic diseases. Usually a single SCQ is asked and 3 to 4 MCQs are generally asked from this chapter in your professional examination, and similarly at least uh, 2 stations in the OSPD are also asked from these hemodynamic disorders. So starting off with the definition of the hemodynamics. As you people can see on your screens, it is the maintenance of the vessel wall integrity as well as the intravascular pressure and the osmolarity within certain physiological ranges. Now, what are the various factors that are involved in maintaining the hemodynamics of the blood vessels, hemodynamics of the blood? There are various pressures which are present inside the blood vessels, like hydrostatic pressure, like plasma colloid osmotic pressure. There is the endothelium that gives a particular shape to the blood vessels, and further, if there is some injury to the endothelium, it may disrupt the hemodynamics, the normal hemodynamics, and can result in the various thromboembolic diseases. So these 2-3 things, along with the plasma proteins, all these, when they act together, they maintain the normal hemodynamics of the blood. So before discussing the edema, just as have a brief look on the normal distribution of the water. Uh, Approximately 60% of the body weight, that is water, and out of that 60%, 2/3 is present inside the cell, that is called the intracellular water, and 1/3 is present outside the cells, that is called as extracellular water, the extracellular fluid. Extracellular fluid is again divided into two compartments, or distributed into two compartments. One is intravascular, that is present inside the blood vessels, and the second one is interstitial, that is present in between the various cells, separating the adjacent cells, separating the interstitium, separating one epithelial cell from the fibroblast, separating the adjacent epithelial cells. So that is called as interstitial fluid compartment, and this is the main extracellular component of the extracellular fluid. So edema. What is edema? As you all know, that it is the collection of the fluid or accumulation of the fluid in the tissues. And if the same fluid, it accumulates in the body cavities, you will see in the next slide, and if the same fluid, it accumulates in the body cavities, it will be called as effusion. Under normal circumstances, when we talk about edema, there are two forces that are operating side by side. One is the hydrostatic pressure of the blood vessel, and the second one is plasma colloid osmotic pressure, that is due to the plasma proteins. The hydrostatic pressure of the blood vessel, it push the water and salt out of the capillaries into the interstitial spaces, while the plasma colloid osmotic pressure, it pulls the water and salt back into the blood vessels. Under normal circumstances, both of these pressures, they are almost equal. Almost equal. Hydrostatic pressure is slightly more as compared to the plasma colloid osmotic pressure. As a result of this slight increase of the hydrostatic pressure, there is usually a small net movement of the fluid out of the blood vessels into the interstitium. So now the question arises that under normal circumstances, the hydrostatic pressure is more as compared to the colloid osmotic pressure, and the fluid, it moves out of the blood vessels and it is collected into the interstitial compartment. Why we do not have edema under the normal circumstances? The answer is that The excess fluid that is collected in the interstitium, it is drained back into the vascular compartment with the help of the lymphatic vessels and the lymph node. As you know, there are lymphatic vessels, there are lymph nodes all over the body, starting from the head and neck region. There are cervical lymph nodes, there are 3 or 4 categories, 3 or 4 levels of the cervical lymph node. There are axillary. The pathophysiological categories of edema, these are the 4 categories of edema, and mainly whenever there is a collection of the edema fluid, or when there is effusion in any cavity of the body, it is related to one out of these 3 or 4 causes. इनफैक्ट 4 लिखे हैं, एक और भी है इनके अलावा. I'll tell you afterwards. One is top of the list being the increased hydrostatic pressure. Again, increased hydrostatic pressure, it favors the movement of the salt and water out of the blood vessel, so can participate in the edema. Reduced plasma osmotic pressure, or the colloid osmotic pressure. Under normal circumstances, plasma colloid osmotic pressure, it pulls the water and the salt inside the blood vessels. So if the plasma colloid osmotic pressure is reduced, again the pulling effect of this pressure, that will be decreased, so salt and water will stay out of the blood vessel, again leads to formation of edema. Sodium retention, whenever there is sodium or the salt retention, it will cause the retention of the water, again a cause of the edema. Various inflammatory disorders that can cause the edema, उसमें local inflammations भी आ जाती हैं, उसमें generalized inflammations भी आ जाती हैं. If we talk about the local inflammation, for example, if there is a bee sting on one of your limb, you can see the classical signs of the inflammation around that that sting, that area where the sting is present. So it may be chronic, it may be acute inflammation, or it may be due to the formation of the new blood vessels, that is called as the angiogenesis. Number 5th important cause, or the number 5th important category of edema, that includes the lymphatic obstruction. Now we'll have just a brief look of the various causes of the edema as compared to when we fit those causes according to their pathophysiological categories. These are the various causes of edema due to increased hydrostatic pressure. It may be due to congestive heart failure, constrictive pericarditis, ascites, venous obstruction, neurohemorrhage, dysregulation, and the heat. Here I want to tell you that there is a very good table that is present in your book Big Robbins. तो लाजमी वो पढ़ लीजिएगा, टेबल एक पूरा पढ़ लीजिएगा. उसमें इस तरह पैथोफिजियोलॉजिकल कॉजेज़ हैं, और आगे हर कॉज में उन्होंने बताया हुआ है विच डिसीज़ और विच डिसऑर्डर that is associated with edema of that cause. So these are the various disorders that are associated with the increased hydrostatic pressure. And moving on to the next category, that is reduced plasma colloid osmotic pressure. एक चीज़ जो याद रखनी है, plasma colloid osmotic pressure is due to, or it is imparted by the plasma protein. So any disorder that is associated with decreased level of the plasma proteins, that will lead to reduced plasma osmotic pressure. There are certain diseases, और उनमें अगर देखा जाए तो important ones, if we look in our country, the important ones are malnutrition, बच्चों में बहुत common है, especially the severe protein energy malnutrition. Then there is liver cirrhosis. Liver cirrhosis की वजह से there may be hyperperitoneum or the ascites. Liver cirrhosis के काफ़ी सारे cause हैं, and the leading causes, they are the hepatitis C virus infection, hepatitis B virus infection, and there are few cases of the liver cirrhosis as a result of hepatocellular carcinoma, as a result of Wilson disease, as a result of alpha-1 antitrypsin deficiency. इसके अलावा अगर देखें तो another important cause of reduced plasma osmotic pressure, that is nephrotic syndrome, in which there is loss of the proteins in the urine. Another important cause is the protein losing gastroenteropathy, in which there is loss of the proteins through gastrointestinal tract. And one very important example of this protein losing gastroenteropathy is celiac disease, which people will study in 4th year MBBS. और बाकी इसके अलावा ये दो लेस कॉमन कॉजेज़ हैं जिन इसके अलावा लिखे हुए हैं, लिम्फेटिक ऑब्स्ट्रक्शन और ये. So mainly these are the four. First four are the important causes of reduced plasma osmotic pressure. ये lymphatic obstruction और inflammatory ये तो अलग से causes हैं. We'll discuss in the next slides. Now coming to the sodium retention. Sodium retention की वजह से edema जो होता है वो क्यों हो सकता है कि excess salt intake, salt की intake ज़्यादा है, खाने में ज़्यादा है. इसके अलावा कोई रीनल डिसऑर्डर हो गया उसकी वजह से साल्ट रिटेंशन होना शुरू हो गई है. अगेन दैट विल लीड टू एडिमा फॉर्मेशन. There is some renal disorders that results in decreased perfusion of the kidney. When there is decreased perfusion of the kidney, there is activation of the renin, angiotensin and aldosterone system. Ultimately, तो पूरा एक cycle start हो जाएगा. People have studied in the physiology that will lead to the formation of the edema. द इन्फ्लेमेटरी कॉजेज़ पहले मैंने आपको बताई हैं. एक्यूट इन्फ्लेमेशन, किसी भी किस्म की क्रॉनिक इन्फ्लेमेशन एंड फॉर्मेशन ऑफ द न्यू ब्लड वेसल्स, एंजियोजेनेसिस दैट कैन एडिमा. लिम्फेटिक ऑब्स्ट्रक्शन जो अभी पिछली स्लाइड में गुजरी मैं बताना भूल गया. लिम्फेटिक ऑब्स्ट्रक्शन कैन अकर ड्यू टू वेरियस डिसऑर्डर्स. फॉर एग्जांपल देयर मे बी इन्फ्लेमेशन ऑफ द लिम्फ वेसल्स दैट इज़ कॉल्ड एज द लिम्फेंजाइटिस. उसकी वजह से lymphatic channels they can be blocked. There may be some trauma, for example if there is breast carcinoma involving the axillary lymph nodes तो उसमें भी lymphatic blockage हो जाएगी. There may be tumors, trauma, fibrosis, repeated inflammation हो रही है, inflammation and repair. Acute inflammation it progresses to the chronic inflammation. Again if there is chronic lymphangitis it may result in the scarring or the fibrosis of the lymphatic vessels, ultimately leading to the obstruction of the lymphatics, and the net result is the formation of the edema. बड़ा इम्पोर्टेंट यहाँ एक सवाल उठता है आप लोगों के जहन में भी. अगर कोई और भी बैठा हो लेक्चर सुन रहा हो तो उसके जहन में भी उठेगा कि डॉक्टर साहब लगे हुए हैं एडिमा. तो ये पता कैसे लगेगा माइक्रोस्कोप के अंदर कि इसमें एडिमा हो गया, कि इस टिश्यू में एडिमा है, कि ये लिवर में एडिमा है, या ये किडनी में इसके इर्द गिर्द एडिमा है, या ये स्किन है, स्किन पे ब्लीचिंग हुई है उसके नीचे एडिमा है. हाउ कम अ पर्सन नोज दैट देयर इज एडिमा? सो इफ़ यू लुक एट द माइक्रोस्कोपिक पिक्चर, इफ़ यू स्टार्ट लुकिंग, दिस इज अ स्लाइड ऑफ स्किन and it is covered by this hypertrophic stratified squamous epithelium. और अगर इसके बिल्कुल नीचे देखें तो you people see these lot of white spaces. और अगर थोड़ा और नीचे देखें तो you are able to see these blue color cells. वैसे तो स्टूडेंट्स को हर ब्लू हिस्टोलॉजी में या हिस्टोपैथोलॉजी में हर चीज़ के दो ही कलर नज़र आ रहे होते हैं, ब्लू और दूसरा पिंक. अगर आपको ये डिस्क्राइब करने के लिए भी कह दिया जाए तो यू पीपल विल कॉल इट फनी लुकिंग सेल्स इन पिंक एंड ब्लू एंड प्लीज़ कोरिलेट क्लिनिकली. मतलब अगर मैं भी थर्ड ईयर में हूँ तो मुझे भी नहीं पता लगेगा कि ये क्या है. सो स्टार्ट विद दिस इज़ ऑन द अपर साइड, दिस इज़ द स्ट्रेटिफाइड स्क्वेमस एपिथेलियम. और उसके नीचे बिल्कुल नीचे ये जो वाइट स्पेसेस नज़र आ रही हैं, दिस इज़ द कलेक्शन ऑफ द एडिमा फ्लूइड. अब यहाँ ये एडिमा फ्लूइड क्यों आ गया? क्योंकि नीचे इन्फ्लेमेशन हुई है, अच्छी खासी इन्फ्लेमेशन हुई है. दीज ब्लू कलर स्मॉल सेल्स, दीज आर द इन्फ्लेमेटरी सेल्स, मेनली लिम्फोसाइट्स. एंड एडिमा फ्लूइड हेयर इट इज़ ड्यू टू द कलेक्शन ऑफ दीज lymphocytes. So this is how the edema fluid or edema will look on the microscopic examination of a slide. So this will be the hopefully this will be the last slide of the today's lecture. These are the various terms which are appearing on your screens which need to be elaborated to you. कुछ तो इनमें से मैं पहले ही बता चुका हूँ आपको. अब ये क्या क्या होती हैं, सबसे पहले तो अगर देखें सबक्यूटेनियस एडिमा क्या है. It is usually associated with the increased hydrostatic pressure. और अगर हम फर्दर सबक्यूटेनियस एडिमा को हम थोड़ा सा ज़्यादा उर्दू में कहते हैं ना, खंगाल लें, थोड़ा सा ज़्यादा हम इसको निचोड़ लें तो इसमें एक टर्म आ जाती है डिपेंडेंट एडिमा. डिपेंडेंट एडिमा basically it is distributed under the influence of the gravity. For example, if the patient is in the standing position, it may settle on the uh, ankle joints, it may settle in the sacrum. If he or she is in the lying position, lying supine, it may settle on the sacrum and the lumbar region. sacral edema हो जाएगा. उसके बाद जो एक चीज़ और लिखी हुई है pitting and non pitting edema. For example, if there is ankle edema, you apply pressure with the help of your thumb or finger, and after 2 seconds, you raise your thumb or finger, and a pit is formed. If there is a formation of the pit, that will be called as pitting edema, and if there is no formation of the pit, that will be called as the non-pitting edema. Next important type of edema or important location, that is the periorbital region, and that is called as the periorbital edema. Edemas which result due to renal dysfunction, for example, nephrotic syndrome. It initially appears around the eyes, or usually the eyelids, and it is called as periorbital edema. Next is the pulmonary edema. For example, अगर किसी को acute pneumonia हो गया, inflammatory cells आ गए, उसमें neutrophils आ गए, या chronic pneumonia है, इसमें inflammatory cells, lymphocytes आ गए, plasma cells, macrophages आ गए, तो जहाँ जहाँ इन्फ्लेमेशन होगी वहाँ भी एडीमा होगा. सो इसी तरह अगर नमूनिया के साथ एडीमा एसोसिएटेड है, दैट विल बी कॉल्ड एज पल्मोनरी एडीमा. Similarly, there are various brain infections. For example, encephalitis. Encephalitis is the inflammation of the brain parenchyma. Meningitis, that is the inflammation of the meninges. इन दोनों में there is brain edema. ये हाइड्रोथोरैक्स, हाइड्रोपेरिकार्डियम, हाइड्रोपेरिटोनियम आप लोगों को लेक्चर के शुरू में मैं एलैबोरेट कर चुका हूँ. Hydrothorax, it is the presence of the fluid in the pleural cavity, or the effusion in the pleural cavity, that is called as a hydrothorax or the pleural effusion. And if the similar fluid that is seen in the pericardial cavity, that is called as the pericardial effusion or the hydropericardium. And if the effusion is seen in the peritoneal cavity, that is called as hydroperitoneum or the ascites. और उसमें मैंने एक और एग्जांपल आपको दी थी जॉइंट्स की, कि अगर जॉइंट कैविटी में फ्यूजन हो जाए, दैट विल बी कॉल्ड एज साइनोवियल फ्यूजन. अच्छा, यहाँ एक इम्पॉर्टेंट चीज़ जो देखने वाली है, एडीमा तो हम सारा पढ़ गए, स्लाइड्स में आपको नहीं मिलेगा. एडीमा होता कितनी किस्म का है, अगर हम देखें उसको ऑन द बेसिस ऑफ इटियोलॉजी कह लें, या माइक्रोस्कोपी कह लें, और साइटोलॉजी की बेसिस पे कह लें, देयर आर फर्दर 2 टाइप्स ऑफ एडीमा depending upon the etiology. Etiologies or the causes of edema, पैथोफिजियोलॉजिकल कॉजेज़ के अलावा अगर हम देखें, वो जो ग्रुप्स हमने पहले बताए हैं, इंक्रीज हाइड्रोस्टैटिक, रिड्यूस्ड ऑस्मोटिक प्रेशर और इन्फ्लेमेशन एंड दिस एंड दैट, वो 4-5 जो ग्रुप्स, अगर उनके अलावा हम देखें तो एडिमा कैन बी इन्फ्लेमेटरी एडिमा एंड एडिमा कैन बी नॉन इन्फ्लेमेटरी एडिमा. इफ़ वी टॉक अबाउट द इन्फ्लेमेटरी एडिमास, inflammatory edemas, they are usually rich in protein, they are usually rich in cells, and they are called as exudates. For example, inflammatory edema में यही कोई सेप्टिसीमिया आ गया, कोई वाइड स्प्रेड एंडोथेलियल इंजरी आ गई, दे आर द इम्पॉर्टेंट कॉजेज ऑफ इन्फ्लेमेटरी एडिमा. न्यूमोनिया आ गया लंग में, अगर वहाँ एडिमा है तो अगेन इन्फ्लेमेटरी एडिमा है. बी स्टिंग हो गई है किसी लिम्ब पे, अगेन है कॉज ऑफ इन्फ्लेमेटरी एडिमा. सो इन्फ्लेमेटरी एडिमा that is rich in protein, that is rich in cells, and that is called as exudate. And non-inflammatory edema, that is poor in protein and poor in cells, and that is called as transudate or transudative edema. अब ट्रांसुडेटिव एडिमा नॉन इन्फ्लेमेटरी कंडीशंस में हो सकता है. नॉन इन्फ्लेमेटरी कंडीशन कौन कौन से हैं जिनमें एडिमा हुआ? वो लिवर सिरोसिस आ गया, प्रोटीन एनर्जी माल न्यूट्रिशन, देयर इज़ नेफ्रोटिक सिंड्रोम, देयर इज़ कंजेस्टिव हार्ट फेलियर, देयर आर मेनी रीनल डिजीजेस which can cause these non-inflammatory edema. So, protein-rich edema, that is exudate, and protein-poor edema, that is transudate. ये 2-3 इसके ये डिफरेंसेस पढ़ लीजिएगा. शायद ये या तो MCQ के तौर पर पूछा जा सकता है, या ये 2 नंबर के MCQ पूछ लिया जाए कि राइट 2 डिफरेंसेस ऑफ ट्रांसुडेट एंड exudate. So this was the first lecture of hemodynamics. Please give feedback to Dr. Amir Alam sir, and hopefully I'll see you people tomorrow from we'll start discussing the next topic, that is the hyperemia and congestion, और इसके साथ साथ फिर हम hemorrhagic disorders की तरफ मूव करते जाएंगे. Till then, Allah Hafiz and take care.